Emmanuel and Diana Becica have lost a close relative in the pandemic. But Diana's grandfather did not die from COVID-19. Last autumn, he was admitted to hospital because of his coronavirus infection. He was due to be released when a fire broke out on the ward, killing him. Emmanuel and Diana learned of the tragedy from media reports.
We were nervously sitting in front of the television. We didn't know what was going on exactly. We didn't know if Diana's grandfather was there at the time.
Diana Becica is herself a doctor, working with COVID-19 patients in a different hospital. She was scheduled to take her specialist medical exam the day after the blaze.
I called my sister and told her, listen, I worked very hard preparing for this exam. It's the most important exam in my life, but I don't want to find out tomorrow morning whether or not my grandfather died in the fire. So please tell me, is he dead or alive? That way I'd have a few hours to process the situation. Then my sister told me he is dead.
On the night of the fire, 10 COVID-19 patients died in the intensive care unit at the Piatra Neamț Hospital in the flames and toxic smoke. One medical expert thinks that the ventilators for the intensive care patients could have overloaded the power grid, but hospital authorities are still awaiting the results of the investigation.
The police sealed off both rooms. We're not allowed inside. The investigation is still ongoing. There was thick smoke that made it impossible to see anything. None of the patients were able to move, otherwise they would have fled. But they were too ill.
The oxygen supplied to the patients further fed the flames, but it is unclear whether or not the blaze was actually caused by a short circuit and faulty wiring. Either way, the medical staff know the hospital equipment was in poor condition.
They tried using fire extinguishers to beat back the blaze, but they had problems. They were later found to have been faulty. Since then, all the fire extinguishers in the hospital have been replaced.
This wasn't the first fire in a Romanian COVID-19 ward. In late January, a fire broke out in an intensive care unit in Bucharest. Here too, the poor state of the medical facility could be to blame. Staff say because the heating didn't work, medics had installed electric radiators in rooms with high levels of oxygen. An explosion then occurred. Here too, the investigation is still ongoing. Vlad Miksic, a doctor and public health expert with the European Union, says it is highly likely the fires are linked to the poor state of Romania's hospitals.
A large number of patients were being treated in intensive care units. Demand for oxygen was very high. Hospitals with electrical systems from the 1970s simply cannot handle the amount of power modern medical devices need. There was no political desire to invest in hospitals. In the past decades, decision makers have not pushed for improvements, and now we're suffering from the consequences.
Over the past 3 months, Romania has seen 3 new health ministers. The current minister confirms the connection between hospital shortcomings and the tragedies.
The fires are connected to the state of the hospitals and their poor infrastructure. I think the main reason for this is political instability. Reforms need to be initiated and seen through, regardless which government or minister succeed one another.
Diana Becica is devastated by the thought that her colleagues lost patients due to faulty equipment.
I cannot believe it. You go to hospital to be cured, but then you die there in a fire. I just cannot fathom it.
Diana's family is suing the hospital, but she wants to keep working as a doctor, despite the shortcomings in Romania's health system.
I hope that what happened will give me the energy to effect positive change. I hope I can soon process this shock so that I can devote myself fully to the people in intensive care. They don't have any relatives by their side, and they're fighting for their lives, like my grandfather did.
The coronavirus pandemic has revealed the dire state of Romania's health system in a tragic way. The country will need years to bring it up to date.